Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Understanding multiple sclerosis is crucial for those affected by it, as well as for their loved ones and caregivers. This chronic illness can significantly impact daily life, but knowledge empowers us to better manage symptoms, seek effective treatments, and support mental health. By exploring the intricacies of multiple sclerosis, we foster a community of hope and resilience, encouraging those struggling to find strength and solidarity. Let's delve into the importance of multiple sclerosis awareness, offering insights and support for a brighter, more informed future. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and to help us comprehend the complexities of multiple sclerosis, we have with us the distinguished neurologist, Dr. Rahul Chawla. Dr. Rahul Chawla is a highly respected neurologist currently practicing as an associate consultant in neurology at PSRI Hospital, Saket, New Delhi. He earned his MBBS and MD in medicine from BMMC and Safdarjung Hospital, New Delhi, and he completed his DM in neurology at the esteemed All India Institute of Medical Sciences, New Delhi. Dr. Chawla has an excellent academic record and has been recognized as an All India topper. In addition to his clinical practice, Dr. Chawla is an accomplished author, having written several books, including Physics at Your Fingertips and Biology at Your Fingertips, which have become valuable resources for students preparing for competitive exams. He is also an advocate for mental health and uses social media to disseminate health-related information. His dedication to medicine, education, and mental health advocacy makes him a prominent figure in his field. Dr. Rahul Chawla, THIP Media welcomes you, sir.
Hello.
Thank you so much. Thank you so much for joining us today, sir. And sir, we recognize multiple sclerosis as, a very challenging condition. So many individuals, they may feel very overwhelmed by their diagnosis. So just to bridge this gap up and foster a better understanding, let's start this discussion with the most fundamental question, that what is multiple sclerosis and what are its primary or main symptoms?
So multiple sclerosis is a chronic autoimmune neurological condition. So what do we mean by autoimmune? That means body's own immune cells, like our own country's army, they have started a program wherein they are destroying their own cells. Okay, so that is an autoimmune condition. So it's a neurological autoimmune condition wherein, so we have a myelin sheath, okay, in our axons, in our neurons. So this myelin is responsible for faster conduction. Okay. And in multiple sclerosis, there is an autoimmune dysfunction that sort of destroys the whole apparatus that builds up myelin. Okay. So when the myelin gets destroyed, the conduction gets impaired. So that is why we call it demyelination. Okay. And because of that destruction of the neuronal cells, there is a damage, then some regeneration happens. So over a period of time, that area gets sclerosed. Okay. And we see that in the form of plaques in MRI brain. Okay. And because in multiple sclerosis, there is a tendency for this mechanism to occur again and again. So there are relapses, and this happens over a period of time, multiple times at multiple locations. So we call this condition as multiple sclerosis. Okay.
And what are the primary symptoms of the condition? अगर एक आम आदमी की भाषा में पूछा जाए तो उसे कैसे पता चलेगा कि उसे मल्टीपल स्क्लेरोसिस हो गया है, या डॉक्टर के पास अगर वो जाता है तो डॉक्टर उसे कैसे समझाएगा कि मल्टीपल स्क्लेरोसिस हो गया है उसे?
तो जैसे मल्टीपल स्क्लेरोसिस डीमाइलिनेटिंग कंडीशन है ना? तो इस तरह की और भी बीमारियां होती हैं. मल्टीपल स्क्लेरोसिस इज वन ऑफ दोस डीमाइलिनेटिंग कंडीशंस. It is a flag bearer, in fact, of demyelination. So we have some other similar illnesses as well, like NMO or MOGAD. Okay. So what happens in this demyelination disorder is that because of the disturbance in the myelin apparatus, the neuronal function is impaired. Okay, so in the brain we have centers for everything. We have center for learning, memory, vision, and that controls the motor part of our body, the limb movement and all. Okay, so depending on the area that is affected due to that demyelination, the person has the symptoms corresponding to that area which is affected. Now, suppose characteristically, MS patients have involvement of optic nerve. Or suppose the patient has optic nerve involvement, which we call it as optic neuritis, the patient would have diminished vision. There will be difficulty in vision. Okay.
Right.
So there's one area in the brain known as cerebellum that controls our gait and balance. If suppose patient has involvement, a demyelinating plaque sitting over in the cerebellum, the patient might have difficulty in gait and walking. So the patient would walk like an alcoholic patient would walk because there is a disturbance in gait and balance. Okay.
Right.
Then we have something known as corticospinal tracts. These are our white matter fibers. Okay. So they control our movements. So just like in a puppet, there is a puppet and there are wires controlling that, So just we can imagine those wires as corticospinal tract and they control our movement. So because they are white matter tracts, white matter means they are full of myelin. And because myelin is getting affected in the demyelination diseases. So because of the disturbance in the myelin regulating all, because of the disturbance in the myelin and the neurons, the patient's motor component that gets disturbed. So patient develops weakness and the patient has spasticity. That is, the muscles get tensed, they get taut. Okay. Similarly, if the patient has certain demyelinating lesions in the spinal cord, okay, so the patient will have a weakness of all four limbs or both lower limbs, depending what is the localization. Then patient might have some urinary complaints. Patient might have numbness in the limbs. Okay, so these are all symptoms of multiple sclerosis, depending on what particular area of the brain or spinal cord is affected.
And what would you suggest that are the known risk factors or potential causes of multiple sclerosis or MS?
See, multiple sclerosis, there is no definitive factor in a way that if there is a presence of that factor, then the person will have multiple sclerosis. But there are factors sort of affect and they increase the risk of having multiple sclerosis. So it is seen that in women between the age of 20 to 40 years, they are more likely to be having multiple sclerosis than men of the same age. Then there are certain countries, Scandinavian countries, or who are away from the equator, who are sort of colder countries, who are known to have more incidence of multiple sclerosis as compared to an equatorial country. Okay. Then obviously family history, if there is history of multiple sclerosis in the parents, then the child has more likelihood of having multiple sclerosis, but it is not definitive. Okay. Then there are some viruses that are known to be involved in the pathology behind multiple sclerosis, like Epstein-Barr virus and some other viral illnesses. And if the patient has got certain viral infections in the childhood, then that might flare up the pathological response that is seen in multiple sclerosis. And later in the adulthood, patient might get multiple sclerosis. So these are just, contemplated risk factors, but it is something that cannot be said for sure that this particular person is going to develop multiple sclerosis in future.
Okay. And what if someone comes to the doctor, you've just mentioned that MRI scanning hoti hai for patients with multiple sclerosis. So just re-emphasizing on this imaging factor for the detection, how is MS diagnosed and what role does MRI and other imaging techniques play in its diagnosis?
Okay, so be it any illness, any neurological illness, we have 3 or 4 different, functionalities or algorithms through which we make a diagnosis. Okay? So first is the history of the patient. So multiple sclerosis patient will have a characteristic history because the multiple sclerosis mainly presents in the remitting relapsing form. So the patient has relapses, patient has recurrent neurological deficits in the form of either diminution of vision, okay, or weakness in one side of the body, hemiparesis, or both lower limbs, or gait imbalance. Okay, so depending on how that illness progressed. So these episodes are sort of acute to subacute in onset, meaning that will evolve over few days and they will progress over few days. Okay, it will not occur instantaneously like a stroke. Okay. And so depending on the history, the doctor will get a clue that, okay, the patient might have some sort of a demyelinating disorder affecting some particular area of brain or spinal cord. So that is history. Then we corroborate those findings on the examination. If suppose
Right.
patient has diminished vision, we look for some signs in the eye. Okay.
Right.
And if the patient has lower limb weakness, we look for the signs in the lower limbs. We look for spasticity. We have
Right.
our own clinical signs which we elicit, and that gives us sort of a localization. Now, if
Right.
suppose the patient has diminution of vision, I get some signs on the eye, then I opt for MRI brain with dedicated study for optic nerve as well, so that I can see some findings on the MRI brain. So
Right.
first is clinical history, then examination, localization. The third is imaging.
Right.
So in imaging, if we are contemplating multiple sclerosis or any demyelinating disorder, we usually go for the scans of brain as well as spinal cord. But the
Right.
dedicated study will be done for that part which we are contemplating on the basis of history and examination localization. Okay.
Right.
Now, suppose if the patient was having bilateral lower limb weakness or paraparesis, and I'm thinking that, okay, the patient might have a lesion in the dorsal cord. So I'll
Right.
get a dedicated study of dorsal cord, but I'll also
Right.
get a screening study for spine as well as MRI brain. Okay,
Right.
because it is seen that the patient are known to be having multiple lesions, out of which few might be symptomatic, few might be asymptomatic. All these lesions, they help in the diagnosis. And there are specific, sequences of MRI that we look at. So in multiple sclerosis, as I already told, that it's a demyelinating condition. So the myelin sheath is full of fat. So once the demyelination occurs, because of the loss of that fat, we see some specific changes, which are known as hyperintensities. So that particular area will look more white
Right.
as compared to the normal side, okay, on T2 and flare imaging. And then we
Right.
also look for contrast enhancement. So it is seen that because the patients can have active as well as chronic lesions. Okay, so the lesions which are active, which are leading to the symptoms, would enhance on MRI. Okay, so we look
Right.
for contrast study as well. So all these lesions which are seen in demyelinating disorders, they can also be seen in other demyelinating disorders and also few infectious diseases. So we try to rule them out as well. Okay, specifically when the patient does not present with symptoms which are very typical of MS. So many times patient present with symptoms which are not that typical, which are sort of atypical. Then we also have to rule out other differentials. Okay, so we go for spinal tap, the lumbar puncture study, and we remove the cerebral spinal fluid from patient, and we send that for specific parameters. So we look for sugar, protein, total leukocyte count. Okay. With the help of that, we might even rule out infection. And
Okay.
specifically for MS, we look for OCBs, the oligoclonal bands, which tells us that there is increased production of some immunoglobulins in the CSF. And that gives us more clue. And it's also a part of the diagnostic criteria for this.
Okay. And just you've mentioned that we have a really long range to diagnose multiple sclerosis. So अगर किसी में ये detect हो गया है, then what are the current standard treatments for multiple sclerosis, and how do they help manage this overwhelming condition?
So multiple sclerosis, as I told you that most of the patients, like 80 to 85% patients, they present with a form of MS known as remitting relapsing MS. Okay, so it occurs, then it resolves. Sometimes that it might even resolve without any treatment. There are cases, where the patient has the first attack of MS, then it resolves on its own. Patient might have some residual paralysis or weakness, maybe 10-20%. Patient
जी.
continues with his life normally. Then someday after 2 or 3 years, patient again has a relapse. Okay. Then the patient takes some treatment, then again some relapse. So it is remitting relapse. It means between the two relapses, there is no progression. Okay. So in these cases, first thing which we do is that firstly, after going through all the imaging and all making the diagnosis, we start the patient on high dose steroids. We call it as pulse methylprednisolone therapy. So because that helps overcoming the acute neurological. So basically, it helps us in overcoming the acute neurological dysfunction that is happening because of MS. So the steroids take care of that acute process, and whatever the magnitude of the damage is being happening at the moment, that is controlled by steroids. Okay. So we give high dose steroids. We continue those steroids for 2 to 3 months. And by this time we decide, should we start the patient on some treatment that prevents further relapses. Okay. So previously, it was a thought that the first relapse patient was not started on any disease modifying therapy. It was just controlled with steroids, and we used to wait till the second relapse. But now with time, we have studies, and now we usually start the patient on disease modifying therapy if we are really confident that the patient has MS. Okay. So what do these disease modifying therapy do? As the name suggests, they manipulate, they modify the pathogenic mechanism due to which the multiple sclerosis is happening. Okay. Because like if there is a fire in your house, so the first thing which we do is you control the fire. So methylprednisolone that helps in controlling that fire. Okay. But why that fire occurred at first place? If it's because of multiple sclerosis, then we have to keep a check on the cause that is leading to that fire. So disease modifying therapy, they do this, they control that pathological mechanism because the multiple sclerosis is happening. Okay. So there are different modalities of treatment. Earlier we used to give interferons, and now we have more and more oral formulations that are available. And these medications have better rates at preventing relapses. They have fewer side effects, and depending whether the patient has high burden of disease or lower burden of disease. If suppose the patient has many lesions on MRI scan, patient has had multiple relapses, and there has been severe deficit due to multiple sclerosis, then we might have to think about adding a treatment that is highly efficacious. Okay. So we have some other agents for that, like alemtuzumab or nitalizumab. Okay, these are monoclonal antibodies. And if the patient has lower sort of lesions, and the disability is not that much, so we might start with a low grade medication that is comparatively lower efficacy as compared to those injectables, and also lower adverse effect profile, so that patient can take it for long. So that is a clinical decision that we decide on the basis of how the patient is doing, and what are findings on MRI and all.
और अभी जैसे हम कहते हैं कि हम 21st century में हैं, तो would you say that are there any recent advances in the treatment which have helped in or which have actually improved the management of multiple sclerosis?
Well, actually, because earlier we used to have interferons. So it's basically that in our ammunition, we have more number of medications available. And because each medication has its own set of adverse effect. These are sort of immunosuppressants. They reduce our immunity, and that makes us prone to the infection. And also they have some other, each medication has different adverse effect. So keeping on the patient in mind, we have more number of medication available. Okay, that can be given in particular set of patients, even pregnant patients. Okay. And then we have more efficacious drugs. So like every year, a new drug comes up that is highly efficacious and has higher rates of preventing, MS rates. And because of the recent advancement, there newer drugs are coming up. And also in terms of imaging modalities, because of the developments in the MRI, we have more sensitive MRI imagings, which are detecting MS lesions earlier, which was not happening earlier. Okay. Also, we have some new modalities in terms of detecting MS at earlier stage. Okay, like neurofilament and some other biomarkers which can be used, but those are all at trial phases. And the guidelines as such, they do not recommend it. Neither we do have them available in India at the moment.
And क्या ऐसी कोई टेक्नोलॉजी है जैसे ब्लड प्रेशर को मेजर करने के लिए we have digital watches, we have a lot of equipment that can be used at home. So do we have any let's say कोई एक टेक्नोलॉजिकल एड जो इस तरह का कोई सिम्टम घर पे ही हमें हेल्प करे कैच करने में जल्दी कि somebody has had an episode of multiple sclerosis?
Multiple sclerosis is a neurological disorder. So whatever is happening in your brain. Okay. And it have like any such markers which a patient can see at home apart from the clinical presentations. So the good thing about multiple sclerosis is that as compared to other demyelinating disorders, that whatever the disability is there at
Right.
the time of first or at least initial few attacks, it
Right.
is comparatively lower and it
Okay.
takes more time to evolve as compared to other demyelinating disorder. For example, if
Right.
the patient develops illusion of vision, it won't occur in 1 or 2 days. It will require few days. Okay.
Okay.
So if there is any symptom, especially in the patient who are known, no MS
Mhm.
patients who are on
Right.
medications, if they feel that they are having some new symptoms, then they
Right.
must go to the doctor, neurologist immediately and have their brain scanned, because
Okay.
patient might be having a new lesion and which might be in the evolution or the development, which can be taken care of as early as possible. And
Right.
also there are certain signs of MS, like patients having chronic fatigue, even some non-specific symptoms like anxiety and depression,
Right.
specifically in young females. And
Mhm.
there is something known as Hermite phenomenon, that whenever patient tends to flex their neck, they have some abnormal sensation on the back or on the limbs. So
Mhm.
certain clinical signs or whatever symptoms patient is having, on the
Right.
basis of that, we can have the patient checked as early as possible. But we
Right.
don't have those parameters like blood pressure, sugar that we can monitor at home.
So proper medical history and proper detection under a
Yeah.
certified neurologist, and then
Yeah.
this is followed by a treatment. This actually, compiles the entire management of multiple sclerosis. Right.
Yeah.
Okay. So क्या lifestyle changes या फिर complementary therapies जैसे कुछ और conditions में help करती हैं? So do they have a role to play in the management of multiple sclerosis as well?
Yeah, definitely lifestyle things do work. As I told you, there are multiple factors which are associated with multiple sclerosis.
जी.
Even smoking is one of them. Okay. So if
Okay.
the patient quits smoking, patient will have lesser likelihood of having multiple sclerosis or having more relapses of multiple
Right.
sclerosis. Okay.
Right.
And maintaining a good lifestyle is anyway, good for any disease, not for
Right.
MS per se. So it is
Right.
obviously recommended, okay,
Okay.
that you have a good lifestyle, you have a good exercise regime,
Right.
and you meant maybe some yoga meditation, because MS patients do have some sort of depression, anxiety, and that all helps with it. Okay. But if you
Okay.
talk about preventing relapses, no, they have
No.
no role. You talk
Okay.
about, patient having along with medication, if the patient can have some improvement in their daily routine with the help of these therapies, yes, that is possible. So that is why we advise for physio rehabilitation for all these patients, that makes them feel better. And also, there is a role in, because MS patients have spasticity, they have tightness in their limbs, so that
Right.
limits their activity, okay, their
Right.
self-confidence. So any such therapy would obviously be better for those patients.
And like you just mentioned that there's still a lot of ongoing research जो
Yeah.
अलग-अलग areas में हम काम कर रहे हैं. So I'm just going to ask you to help us understand that, summarize करने के लिए for the session, कि इनमें सबसे promising areas कौन से हैं जो management में और शायद patient recovery में भी हमें help करें in cases of multiple sclerosis.
Well, see, these things will keep on happening every year,
Okay.
because MS is
Okay.
one of, a very highly researched subject.
Right.
And a lot of research is happening, and it has happened, and it has actually revolutionized the whole treatment paradigm. Okay.
Right.
And not just newer drugs are coming up, whatever drugs are coming up, they have lesser adverse effects. They have better safety profiles, better
Right.
tolerance. Okay.
Okay.
Regarding imaging modality also, many things are happening, and as I've already told, many things are in progress. So maybe we can have a breakthrough in that regard. But one thing
जी.
which we have to understand is that it is not a curative disease. Okay.
Right.
So there is nothing like you take a tablet, okay, your MS is over. It's not like that.
Okay.
Okay, because
Right.
the disease progression is going to occur, because the
Right.
pathological mechanism is happening inside the body. Okay, so we can
Right.
just prevent relapses. We can keep that under control. We
Right.
cannot just completely eliminate that thing. Okay.
Right.
Having said that, there are other treatment alternatives available in terms of stem cell transplantation
Right.
for refractory MS patients who are not even responding to the high grade of medication. They are still relapsing on that, and
Right.
more research is happening on in terms of stem cell and mesenchymal stem cell transplantation. And
Right.
that is something people are looking forward to.
Great. So we appreciate your presence with us today, sir. Thank you so much for joining us today.
Yeah.
And I'm hoping that the enlightening information shared will be valuable to many families out there. And it's really, really been a pleasure.
Thank you so much.
Thank you, sir. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.